Good afternoon, everyone. Again, this is Precious, BRCO's new operations manager. It's a pleasure to meet you all virtually. Thank you all for joining us on this fifth Wednesday. We're excited about the training this afternoon. We've gotten some feedback from the super users and polled the regions. And one of the things that we heard is that you guys really wanted a refresher as we got prepared to resume in-person services in the coming weeks. So please utilize the chat to ask questions. We're going to be pointing you to a lot of resources for you to follow up on, and also pointing you to the super users in your region so that you can get more one-on-one about the topics that are discussed today. And with that, I'll turn it over to my colleague, Daniela.
Hi, good afternoon, everyone. This is Daniela Wilson. I'm the Clinical Assistant Support Manager in Health Informatics. It's also known as the EHR team. We have a full agenda for you guys today. So I'll just go ahead and walk through the objectives. We're going to do a Moodle refresher. So we're super excited about Moodle, and we want to be absolutely sure that that everybody knows how to get to Moodle and knows what to do once you get there. We want to be sure we're communicating effectively with you guys, and we have a consistent message, and so Moodle is literally the platform that we're using to help us do that. Entergy version 12.10 release readiness, that's coming next week, and we want to make sure you guys have the information you need. We've gotten a lot of requests for new user accounts, so we're going to kind of give a refresher on what the proper process for that is. We're going to go through day in the life of a clerk. It's going to start with opening the day's journals to the end of the day reports. I'm not going to list all those things out, but as Precious said, we've received a lot of feedback from our super users and regional leadership, and also some audits that we've done. And so these are some of the things that we're going to absolutely focus on during that day in the life. We're going to introduce you guys to some new appointment types. There's also an application error that you guys are getting, and so we want to cover that information. There's some user guide revisions that we're going to cover, and how to get help refresher. All right, gang, let's get started. We have a lot to do.
Hey, everybody, this is Tammy Bennett, and I'm the Reproductive Health Statewide Nurse Consultant. Going to be going over just a couple of Moodle reminders. Moodle is a web-based platform, so you can access Moodle from any computer, and listed into this PowerPoint is the web-based. You can click on that link, and it'll take you directly into Moodle. Again, if you need to know how to do Moodle or how to go into your modules, and there is a YouTube video that you can go to, and it will show you exactly how to complete all your modules. There is also, I'm getting constant emails directly from people, please add this person or remove this person. This is the link that you will need to go to if you need to add staff or remove staff. All right, so after the trainings, just as a reminder, it'll probably take about 24 hours to get these recordings processed, uploaded, and tagged onto Moodle. So give it about a day, go into Moodle, and then if you're viewing these trainings live, like you are today, you'll just go in and you'll just check off that you attest that you have viewed that training. If you were not here, for whatever reason, tell your cohorts to go in, watch the video, and then you can attest that you have completed that training. We'll give participants 2 weeks to complete anything we've just uploaded. At the end of that time, I'm going to pull the data, and anybody who has not completed the required modules is going to get an email directly from me. And that is so that sometimes we just forget to check a checkbox, or we forget to do something. And so if you get an email from me, that means you are showing up on our incomplete roster. And you will have 2 days, next slide, you'll have 2 days to go in and complete whatever is not checked off. At the end of that, then we're going to pull a list. We're going to pull a list, and that's going to go to the regional leadership team. And at that point, the regional leadership team will work directly with their staff that's on that incomplete list to get everything completed. We are consistently having issues with incompletions, so that I think will help directly if we directly communicate by email. for whatever reason it's not showing complete. Next slide. There are some non-Title 10 module assignments that you will see. There is one for EHR clinical. There is one for EHR clerical. Standard operating procedures. There's a video resource library. So if there's a video that you missed or you need a refresher on something, you can go in there. Any of the telemedicine policy and procedures along with those telemedicine videos. And if you're Title 10 staff, of course, you're going to have more Moodle modules on your dashboard. You can see everybody that's assigned. Everybody that's in Moodle is assigned to a specific role or cohort. If you're assigned to multiple cohorts, you may have multiple modules. For instance, just to give you a little clarification, most of you on the call today are clerical. However, you are going to be in the standard operating procedures and video resource library as well, just so that you will have access to what you may need in the future. All right, next slide. If you do find that something's on your dashboard and it doesn't look like it applies to you in your role, please email me at this email address and include your name, what role you work, what region you work in, and all programs that you work in. So if you just work reproductive health, that's great. Tell me that. But if you work reproductive health, CYSHCN, immunizations, TB, I need to know that as well so I can make sure that you have the correct modules on your dashboard. All right, next slide. And that is all I have for you today as a Moodle reminder. After this is done, give me 24 hours and it will be uploaded onto the presentation into the clerical module.
Yeah, so we did have one question. It's a good one, so I'll read it out loud, and that's from Rena. And it's asking for staff on training today, will they have to go into Moodle and mark that they completed, or will it be updated from their participation? And Deborah did answer and said they will have to go in and mark that box, just like last time. You'll have to, after training, go in, which I think is tomorrow, actually is when everything's going to be loaded, and mark the box that you were here today.
Correct, and just so everybody's on the same page, we used to have to pass around sign-in sheets and see who was actually live. Your sign-in is actually going into Moodle and checking that box, and that says that you have watched the video, either live or the recording that will be uploading. So make sure you check that box.
Hi, this is Laura Austin. As Daniela mentioned, we have Entergy version 12.10 upgrade on the horizon. We're scheduled right now for next Wednesday. There are some clerical specific notes that will be available in Moodle to show you some of the things that will be changing and the differences you will see once the upgrade happens. We're also going to try to point out some of those changes and where you will see them as we go through this workflow step by step. If there's an area where we are expecting a change, we'll point that out to you in our videos or demos. And as I said, there will be additional resources provided on upgrade notes, as well as a link to the version 12 online help file. One other thing we wanted to mention is requesting new user accounts. The information for new user accounts has now been moved into Moodle. There is a section for the BHI new Entergy user request forms. The first thing on that list is requesting accounts for Moodle and EHR. That document contains a link to the SOP for provider credentialing for providers. In addition, there is a link to the form that you need to complete to request or remove Moodle access for anyone that has joined our team or has left. Then there are instructions for how to fill out the forms and the process for submitting that, as well as the electronic forms, each of those specific to your region. So you can now find all that information on Moodle under it's under both the clerical and clinical modules. And now we will continue with our day in the life of clerk. One of the first things we wanted to mention is that we have added the information for login and password instructions to the clerical user guide. The first thing you will find in your new copy of the user guide is the instructions not only for logging into the Citrix login, as well as the password requirement changes that have come about for that, but also how to log into Entergy, set up your security, as well as instructions for how to switch users. That's all been added to your clerical guide. And one of the first steps in the clinic is opening your day's journal. So we now have a video for that.
Opening the day's journal. To open the day's journal, select the financial menu at the top, go to Journal Management. At the Journal Management screen, it's suggested you click on Name and search for your location to ensure that no one has opened a journal for the day yet. If you do not find your location, you should select New, select the drop down under Journal, find your location, ensure that the post date is today's date, and save. You can then close the journal management window. Some helpful tips for journals. One journal must be utilized per health unit. An additional journal may be opened for special events such as flu clinics, but that is not required. Since some PHUs are sharing journals, someone may have opened journal for the current date. Please be sure that you search for a journal, and if one has already been opened, select that journal for use for the day.
Checking for records prior to registration. When you have a patient come in, you can ask them if they've ever been to a health unit. If they say yes, do a search and find that patient record for that person in Entergy. If you cannot locate it by just a name search, you may use alternate means. Try date of birth, try last name and just the first letter of the first name. If they say they have not been to a health unit, you're going to add them into Entergy, but always search for that patient before you create a new record. Even if they say they haven't been to your health unit, they may have been to one in another state. Since this is a statewide health record, they may have been elsewhere and they do have a record in our system. So always do a search whether or not they say they are a new patient. If you do a search for a patient and discover that they have two medical records in the system, you can request that we merge those records. Next slide. For duplicate patient accounts and medical records, it's important that you proceed cautiously when requesting a merge, because once the records are merged, they cannot be undone. To request a merge, you need to input an LDH service request for a record merge. You're going to provide the patient ID numbers and designate which record you want primary. That is the record you wish to keep. Here on this slide, you'll see a list of tasks that must be completed before that merge can happen. This information is also in your clinical user guide. It notes things like you need to make sure you cancel any future appointments on that secondary patient, make sure that it's an active record, resolve any unsigned encounters, labs, prescription requests, recalls, and secure message queue. Any of those items that have not been completed will stop the merge, and we'll have to reach out to you and let you know what's still missing. So please, when you're requesting a merge, have a look at that list of items that's in your user guide and verify that those things have been resolved before you request a merge. In addition, we wanted to remind you that there are telemedicine videos available under the Telemedicine Policy and Procedures module in Moodle. As you'll see here, when you click into that module, third item down is recording for telemedicine. There is one for reproductive health, one for CYSHCN. There's also a recording for the Zoom workflow and the REDCap. So if you have any questions about the process for telemedicine, for using Zoom, using REDCap, you can go into your telemedicine policy and procedures module and review those videos.
So hi, everybody. There's been a lot of confusion maybe on how and when to use the waitlist. So the waitlist in Entergy should only be used when there's not an in-person template available to schedule that in-person patient visit. So as you know, the nurse practitioners 5 days a week have a telemedicine template. So if a patient is identified that needs a in-person, there's not anywhere to schedule them just yet. However, coming very soon, there's going to be some hybrid templates for each APRN that will show what days they're going to be in person at what health units and what days they're going to continue to do telemedicine. So those are coming, and once they're built, then you should be able to schedule any in-person visit directly into the next time they're going to be at that health unit, just like we were before COVID. The only time in the future we should have to work, we would need to use the wait list would be if you cannot get a patient any appointment in the next 5 working days. That's a Title 10 requirement that we use a wait list if we cannot get any appointment in the next 5 days. Again, here's a link to the YouTube video on how to use the wait list until we do get those hybrid templates made in the schedule.
All right, and here's a video for patient messaging.
Patient messaging. To ensure that messaging is sent correctly, patients should now be asked how they wish to receive appointment notices and reminders. Before scheduling an appointment, ask patients about messaging participation. Let them know we now offer appointment reminders by text, email, or voicemail. How would you like to receive appointment reminders? Based on the messaging selections, completed fields are as follows: email address and phone number, followed by preferred phone and/or the email selection, then the selected contact method. In Entergy, patient registration is accessed from the patient registration icon. In the new patient registration window, select Quick Register. From the Quick Registration, fields are located here. After messaging entries are filled with an email and phone numbers, verify them again, and then you will select the preferred phone selection. From the preferred phone drop-down, this window appears. The preferred phone selection is the phone number set as the preferred phone type. The code selections are indicated by their description: M for mobile, H for home, and so forth. From the method drop-down, this window appears. The method of contact must be set for the messaging type. The code selections are indicated by their description: V for voice, E for email, T for text, D, do not contact. If the patient has not selected a method of contact for messaging, you must set this field to D, do not contact, to ensure the messaging system does not send messages to the email address on file. For the method, voice messages to home or work, the preferred phone, code H for home, W for work, contact method V for voice. For the method voice or text to a cell number, the preferred phone is M for mobile, Contact method, V for voice or T for text. For the method email messages are sent, the preferred phone and contact method is E for email. Where no email is provided, use noemail@la.gov. In Entergy, from the patient edit information screen, to access the edit patient information screen, click Edit. In the Edit Patient Information screen, fields are located here. Again, verify the phone numbers, preferred phone and or email address. Again, here the preferred phone method, both selections drop down the same way. Now the patient is ready to be scheduled for an appointment. The patient will immediately receive notification of the scheduled appointment, and a reminder will also be sent 2 days prior to the scheduled appointment.
Scheduling, canceling, and rescheduling appointments. To access the scheduler, select the scheduling menu and appointments, or use the scheduler icon located on the bar. There are multiple views available. This first, resource detail, shows you one appointment in each time slot for the day for a single provider. Resource conflicts will allow you to see if there are multiple appointments scheduled at the same time slot for a single provider. Multiple days will give you a week view for your provider. Multiple resources allows you to view multiple schedules for a group of providers. This example is for statewide APRNs. You can page through and see all the appointments scheduled for that day for all APRNs statewide. There's also a monthly view. This will show you a quick overview of days that are available for scheduling and how full that provider schedule is on each day throughout the month. For example, this Friday, the 25th, is 63% booked, while the following Friday is only 13%. This is an easy way to see availability for your provider when you are trying to schedule annuals or other type visits. To schedule an appointment, you can simply right-click on the time slot you have chosen, select Make Appointment from the drop-down menu. You will search and select your patient. You will then enter your reason code for the type of visit. An appointment class if required. Verify the location. Add any notes that are needed. And save. Your patient is now scheduled. To reschedule an appointment, simply right-click, choose Reschedule Appointment from the drop-down menu. Be sure to select a reason for the reschedule, whether it's the office or patient rescheduling or any other reason for the need to change the appointment. Select Save, and you will notice that you are now marked as Reschedule in Progress. Simply access the day you wish to change the appointment to, find the correct time, right-click, Make Appointment. You will notice that all the details from your previous appointment have been filled in for your appointment schedule. Simply select Save, and your appointment has been moved to the new date. To cancel an appointment, select your appointment, right-click, simply select Cancel. You will once again want to be sure to select the correct reason code and save. The appointment has been removed from the schedule.
All right, let's do some Q&A. I do want to circle back for just a second. There was a question regarding Moodle that it was a great question, and so I wanted to go ahead and say it out loud. Someone asked if the Spanish consent was also on Moodle, and the answer to that is yes. Spanish and Vietnamese are on Moodle. And I think it's notable that anything that you guys need or use in terms of resources or forms should be on Moodle. If there's something that's not on Moodle that you really need, please reach out to us and let us know, because the end goal is to get everything, every resource that we need to do our job into Moodle for easy access. So I wanted to make that note. A question about if a minor puts yes to text messaging or by email, can we enable for them to get messages? The answer is yes, not for portal, but for patient messaging. If the proper preferred method of contact is indicated, then that patient will get patient messages for appointment reminders. How do I request clerical access rights for some of my nurses? We're in the process of actually revising the new user request form that's going to eventually become the new revise or delete user request. And so that form will eventually become the source of truth in terms of requesting new roles. But for now, if you'd like, you can submit a help desk ticket and let us review which roles are most appropriate for the staff. And then, we'll announce and also put it on Moodle whenever the form is revised. So the next question is, can phone as a method on consent form be changed to voicemail to match Entergy method selections? That's a good point. So there's a preferred method of contact and there's also an all method of contact. So we'll look at that just because I think our intentions were to match those selections identically so that it would flow, but we'll look back at that and make sure that it does. So thank you for that. All right, guys, I know we've covered a lot of stuff, so if you guys have any questions, please feel free to unmute yourself or you can use the chat. Everything that we've covered to this point has been things that have been identified as real opportunities of improvement. I know it's it didn't have much of a flow so far, and that's just because we wanted to make sure that we got this stuff in, especially patient demographics and the quick registration, that's kind of new, and patient messaging specifically. We ran a lot of audit reports and we got some work to do, and so we wanted to take the opportunity to thoroughly go through everything just to be sure that everyone understood. All right, we'll keep going.
All right, thank you, Daniela. So this is Deborah Even. I have chatted with a lot of you and have been on some of these trainings. And what I'm going to be going over, hopefully, will be clear, and you all will definitely see it. We reviewed this with the clinical staff this morning, but this is a change in some of the appointment types for TB. We found that we needed some clarification on some of these. So for the TB lab only, it was called in the past NSE for nurse. That hopefully will be clearer for, as an appointment code called TB lab. You will still see the same description, but the appointment code, which is only allowed 6 characters, I believe, will be called TB lab. In addition, there's going to be an upcoming change in who can order the radiology. And so the appointment code there, and this is new, will be called TBCXR, and that stands for chest x-ray, okay? And so some of the information that you see here, and I purposely left this in just so you all would know, this is not considered a nurse visit. So when this type of encounter comes through to you all. You should not see an E&M code. It's just things that you can refer back to. If you do see it, you will see a diagnosis code and a procedure code for an x-ray, and that should be it if it's radiology only. The other thing that the TB program really wanted to highlight was that there are various ways that TB patients come into our clinic. One of them is this electronic disease notification, and there are two types of appointments here. One would be when the TB-DIS receives notification from this federal program and the patient is put on a nurse visit. And so this code is going to be called TB-EDN. You likely already see most of these, but they just haven't been classified as EDN, which stands for Electronic Disease Notification, in the past. And then the second type here will be a follow-up after this nurse visit, and they will actually see the medical provider for your TB clinic. So just be aware of how this is coming in. So your TB-DIS should notify you, and Angela Blanchard, who is the consultant for the TB program, does work, and Jamie Woolley do work closely with the TB-DIS. So we're hoping to make that communication more fluid. So they should notify that this is the type of appointment that needs to be set for these patients, either nurse or medical. So one thing to highlight, Regions 4 and 9 are well aware of this, is a relatively new program that TB has. The appointment code is TB FBO, and that stands for Foreign Born Outreach. This program is really only in Regions 4 and 9 at the moment. There was and is still the intention to expand this, but it has been placed on hold due to COVID, so it has not moved further than Regions 4 and 9. So once this program resumes, then that will expand to the other regions, and then you will use this TB FBO. So anyone that is identified as foreign born can be offered a free T-spot under this program and follow up if it's positive, and treatment if indicated. So that is an FYI for in the future for the rest of the regions that are not already doing this. Next slide. One thing that I know has been at times a source of confusion, and we checked with some of your leadership and super users on how this was getting put in to the system, is the difference between a refugee and an immigrant. So a refugee, what is really notable here is this is generally a person who has fearfully fled their country because of the threat of persecution due to any number of things, political affiliation, race, gender, any type of persecution that they may have encountered in their country, and they come here under a special program and they receive asylum, at least in this country, and that's what we're referring to here. So a refugee is someone who is under the threat of persecution. An immigrant is a person who voluntarily leaves their country and chooses to resettle in another country. And in this case, we are talking about the United States. You can move to the next slide. And the reason we bring this up is because we have added 2 appointment types, and they're not necessarily, they don't necessarily fall under the TB program. This first one that we have coded RMA, which stands for Refugee Medical Assistance, is a type of refugee health screening that includes TB, some TB testing, it includes some STD testing, and it can include some immunizations, okay? Generally, these folks, and I have seen them come through the TB-DIS, but generally these folks have come through a Catholic Charities program and Medicaid, and generally when they come to us, they have not received Medicaid yet, but do fall under this category. So the TB program will cover the TB labs. And then just to differentiate so that we're aware of how many of these type of patients we're actually seeing, and differentiate from the immigration screenings, this is for an appointment that is for immigration purposes only. And again, the TB program will cover the cost of the T-spot. All right. Any questions so far?
I don't see any about the new appointment types, Deborah, but I do see one that we can circle back to regarding the consent for patient messaging.
Yeah.
And the question is that question is that question obtained in the telemedicine LDH consent or not, and where specifically is that question asked obtained for telemed visits? And so Tammy did answer and said the question for consent for patients messaging is in the REDCap project under the LDH consent for services. It asks all methods that they can be contacted as well as preferred methods. So the clerical staff will need to review the REDCap compact data to see what they said for this question. That was a great question. Thanks for that. All right, do we have any more questions? So we want to encourage you guys to continue to invite all patients to participate in Patient Portal. Portal participation is a large part of our Promoting Interoperability Incentives program, but there are times when patients decline to join the portal. So when patients are invited to use the Patient Portal but decline to participate, we now need to set their access to declined. And we have a video for that.
Decline Patient Portal. To decline the Patient Portal, after your patient is selected, choose messaging from the left-hand side. Select Edit Access. From the Select Action drop-down, select Decline Access and save. Status should change to Access Decline.
I know that a lot of y'all have been having some issues with scanning into Entergy. We have created a workaround, but we're going to do a quick little video demo of that for you so that y'all can ensure that your scans are getting into Entergy. Scanning into Entergy. In order to scan into Entergy, we must ensure that we have a folder to receive the scans. To do this, you will go to the Start menu, this PC, your C drive, and you will look for a folder called Entergy Scans. This PC does not have that folder, so I will create it. Right-click, New, Folder, you will name it Entergy Scans. Once you've completed that, you can close out of the folder. Now, in order to actually scan into your PC, you will need to open your scanning utility. I use Epson Scan as I have one of the bar scanners. I set the resolution to 200 and I use a color scan. I found that this is the best settings for both quality and size. You will load in whatever document or ID you are attempting to scan. Hit Scan. It will open up a dialog box. I have already set this to the Entergy Scans folder, but if it is not, you will go to Browse, Windows C, Entergy Scan, and tell it OK. The file name can be renamed to whatever it is that will be most convenient for you. For my purposes, I'll leave it as is. Ensure that your image type is set to JPEG. ID cards, insurance ID cards, driver's licenses must be set to JPEG. Otherwise, you will create an error that will shut down Entergy. Tell it OK. It will begin to scan. And as you can see, it opens up the Entergy Scan folder. And here is our lovely ID card. In order to actively import that into Entergy, you will open Entergy. Once Entergy is open, you will select the patient that you wish to use. And you can see that they have no ID available. So we will open that dialog box by double-clicking, import, and then we will navigate to the C drive on machine name. Do not use this local C disk that has no name. You must use the local disk C on with a computer name. We will find the Entergy scans folder and then import the image that we want to use. The image is then imported. We can close this dialog box. You can do the same with insurance cards. And once this is imported, you can close this dialog box. And that is how you will always successfully be able to bring an image into Entergy. Okay, and now we're going to move on to a live demonstration from our friends with the revenue team.
Good afternoon, you guys. This is Dana Randall, and the revenue team will start the live demonstration from when the patient arrives for their appointment. The first step is going to the patient flow tracker. This is our patient. We're going to right-click, record event, and we're going to say that the patient arrived by clicking ARR. When we do that, the patient is going to access, if they have multiple accounts, they're going to access which account we want to use. And we're going to select that account, and it's going to bring us straight to patient information. When it brings us to patient information, we want to review the demographical information with the patient and ensure that nothing has changed since we scheduled them. And so we're going to make sure that there is an email address. If there's no active email address here, we're going to go through those prompts that we heard about today, and we're going to ensure that we put no email at la.gov if there is no email address. We also want to make sure we review the Social Security number, that there are no nines or no all repeat numbers that are here in the Social Security number. If we do, we will want to edit and remove that information. We also want to make sure that there's a scan ID in the system, which we just talked about scan. So here, we want to verify that there's a scan here. The next thing we want to ensure when talking to the patient is that the insurance information is accurate and up to date. So we want to verify with them that they have a copy. We're going to scan that copy of the insurance report here in this section. And for today's date, the patient is receiving immunization. And today we see that Blue Cross Blue Shield is listed. So we have to go through the VSC screening, which we will do a little bit later, but we want to ask them initially, hey, we see that you have Blue Cross Blue Shield, which is a commercial plan. Are you underinsured? Do you have insurance to cover this? If they say yes, then we're going to have to refer them to their primary care because we know that they won't be eligible for those services. But if they say, no, I'm underinsured, my insurance company doesn't accept vaccines, so then we'll ensure that we go here and we change the coverage to ensure that we have the base plan for immunizations. So we're going to do that. Base plans are found in the front office user guide on page 118, and that's in the appendix. So here we're going to go to coverage. We're going to remove Blue Cross's primary, and we're going to add the private pay for immunization. And now we see a 1 by here, so this is active, and we're going to save that. If the patient really had Blue Cross and they were in here for reproductive health services, which is covered by their insurance, we would ensure that we check eligibility by going to the patient eligibility screen, verifying whether they have active medical coverage for that visit. And if they don't, then you want to make sure you use the correct base plan for private pay. We also want to make sure we're running eligibility checks for both primary and the secondary insurance, which is found in the front office user guide, page 41 through 42. So now that we've verified the demographical information and the insurance information, we now want to go to the consent. Consent is found under privacy. And there needs to be a consent here for the date of service. And so we want to, for each date of service that the patient's coming in, there has to be a new consent. So we're going to go here and mark yes, yes. My date of service is 10/1/2020, and In addition to signaling this or denoting this in the system, this coincides with the consent form that the patient signed to receive service. So we want to make sure that the consent for service is scanned into imaging, as well as denoting here in the system that the patient consents for service. Okay, I'm doing it for a future date, so I'm just going to do this date. Save it. Okay. If the patient is a reproductive health patient and they're coming in, the next thing we want to review with the patient is the confidential billing policy, or SOP. And we're going to indicate to the patient that to protect their rights to confidential billing, if they share insurances with their spouse or their parent, an EOB may go out to the house, and there is a possibility that their parent or their spouse may see the EOB, which indicated that they received services. So if the patient says, no, I don't want that, we want to make sure we edit and say, yes, the patient indicates that they don't want the EOB going to their house, and that they don't want to bill the insurance company, and they're going to be responsible for the services. So when you put yes here, that the patient wants confidential billing, you're also going to ensure that the insurance is removed from the insurance section. And here, the insurance is removed from this section, and then you're adding the reproductive health special population or regular reproductive health claim code. The next process, if not, just please make sure that you enter your questions into the chat section. So the next section we want to review is the household assessment piece, which you would go to the sliding fee in order to ensure that that is completed. Daphne Dunn is going to review that section.
Hello, you guys. How you doing today? Good afternoon. We're going to go over the slide and see household assessment. This workflow can be found in your front office user guide on page 20 and 21. The documented selections we want to choose are yes, Y for yes, P for pending documentation, and N for no documentation. The yes documented the proof of income and complete this section based on the information in the document. Once we select yes, this is effective for that date of service and is good for expires in 1 year. All documented proof of income must be scanned into the patient's account. Make sure that the income period and gross income matches the documented proof of income scanned into the patient's account. We also want you to note that if the patient has income on a phone, it must be printed, emailed, and scanned into the patient's account. If the proof is not scanned into the account, there is no documentation. There's no documentation. Approved documents are found in the guide on page 96. Patients with Medicaid cards can use their proof of income and are allowed to verbally declare their income. If no proof of income is provided, then the patient can provide verbal declaration for the very first visit only, with a P for pending, which expires in 2 months. The self-declaration of income document must be completed, signed, and scanned into the system. If the patient comes back for a second visit and does not provide that proof again, then the second half of the declaration form must be completed and scanned back into the system, and the patient will be full pay, with the N saying no proof of income is indicated, which expires in 1 year. Household assessments must be verified and updated at each visit. There should always be a current, effective, and expiration household date in the patient's account. Patient slide fee schedule should always appear in the slide type field. If there's no slide level discount, submit a help desk ticket in order for for the revenue team to review the account. Telehealth visits are allowed to self-declare pending for 2 months. You can also select the history to view the previous household income and special population documentation. Special populations are only used for private paid reproductive health services. The language is updated on page 21 and 37 in your front office user guide. Family planning fee adjustment schedule is updated on page 99 and 100. Are there any questions pertaining to the household assessment?
Hey, Daphne, we do have some questions in chat that are noteworthy. So one question is, Paula Mitchell, if you remove the insurance so it is not charged, why would we then check the confidential billing so that the EOB doesn't get sent, is the question. Dana, you want to go back to that?
Right. So on this particular patient, it's immunization. So we were giving you a what-if scenario as if the patient really had Blue Cross Blue Shield for their reproductive health service, and if this patient was a reproductive health individual, then we would ensure that we mention confidential billing and give the patient all of the information needed in order to decide what they're going to do. And then at that time, we would ensure that we put the correct base plan code on it.
Awesome. Thank you for
that. So
that.
we're just giving another scenario. Yes.
Okay. And so then Dana, I'm sorry, Deborah asked a question. If the patient does not have a social, the social security number field should be left blank and not a required field, and no need to have any numbers in that field at all. And so Laura did answer that question in chat. Correct. Valid social security number only, or leave it blank. That field is not required in Entergy. Another question we have is, when do you use N for no documentation versus P for pending?
So N is the patient does not have any documentation at all. They're in the clinic, they don't have documentation. P for pending is if a patient initially comes to clinic and that's their first time, they can only self-declare once. So they can self-declare for that initial visit pending, meaning that upon their next visit, they're going to bring proof. If they return with no proof, then it would be no. And we can do pending for telehealth services as well.
Awesome, thank you for that. So another question is, they have to provide income even if they have Medicaid?
No. I did state that if a patient comes in and they have Medicaid, they are allowed to self-declare their income. Medicaid is their proof of income. We need to make sure that that Medicaid card is scanned into the patient's account and verified in order for them to use that as proof of income.
Awesome. Great questions, guys. I don't see any more questions, so we want to keep going.
Okay. Documenting, if the patient is receiving immunizations, we want to complete the VFC 317 eligibility status must be verified and completed. So we want to go to the personal tab. We want to select the questionnaire to determine if the patient is VFC or 317. So we will go to the questionnaire, we will select new, determine if we're doing VFC or if we're doing 317. So we're going to do the VFC. Once we select the VFC questionnaire, we want to put the patient's date of birth. It should be between the ages of 0 and 18. If we have anything between A and B is marked with a yes, then this patient is considered VFC eligible. If anything marked with a yes between E, F, or G, this patient is not eligible for VFC vaccine, and it should be referred to their private provider. And from here, if we want to do the questionnaire for 317 vaccine, we want to go to New, select the 317, and we want to put the patient's date of birth. We want to indicate if they're uninsured with a Y or underinsured with a Y. If any of these are no, then the patient is not eligible for 317 vaccine, and it should be referred to their private provider for immunization. Once we've documented the VFC for this patient, then we're going to come to the insurance tab, select VFC. And here, we're going to put what qualified the patient for VFC. If it was Medicaid, whatever it was, select OK. And then we want to put the effective date, the date the patient is in for services for immunization would be today's date. And then we want to save that information. Are there any questions pertaining to the VFC, insurance VFC?
So we do have one question. If no Medicaid card, do we scan in the MEPS for proof of income?
Yes, we can scan it in, but we need to make sure that we let the patient know that they need to bring in their Medicaid card. They need to have we need to have a copy of their Medicaid card on file initially. So, you know, that would be a temporary thing, but we just need to make sure that we, you know, ask the patient to bring in. If we want to add a note to the record statement, we did ask them to bring a copy of their Medicaid card.
Awesome. So if the patient gets back to the nurse and we are in the chart already, can we just update the VFC status in the order section, or do we have to do it in this section?
It should be, the VFC form should be completed.
So the VFC portion is completed by clerical. The order section, I think, is done by the clinical side if it wasn't completed by the clerical team.
All right. I don't see any more questions, ladies. Wait, let's see. Yes, but if it, so this is just a follow-up. If it is not completed by clerical, can we do it in the order section?
Yes, I believe that is the case. Deborah, did you advise the clinical team that they can do that?
It can. And so what I told them was to be sure they knew what made them eligible or ineligible, or had that, you know, that documentation was there somewhere, but they can. And I have told them to check. It's really important because when the immunization program consultants come to audit our charts, that is one thing that at least one of our regions already was, I don't want to say dinged, but it was noted that VFC eligibility status wasn't on there. So if they're not eligible, just put it. If they're coming in for vaccine, yes. If they are, then yes. And if you forget, you can update it or have the nurse do it. Yes, it's easy to do from the EHR side.
But best practice is for clerical team to do it so that clinical won't have to do it in the order section once they get back.
Correct.
So please make sure that you follow those processes and those steps to make it run as efficient as possible. So again, just to recap, you know, when the patient comes in, you check in as arrived, you're going to go through the demographical, the insurance, you're going to do the consent under privacy. If they're reproductive health, you're going to go over confidential billing and then ensure that the household assessment is complete. Once all of that has been done, the next thing we want to do is go back to the patient flow tracker, and we want to record that the patient is in. And then once the patient is in, if we decide that we want to collect some money before we do that, if we're going to collect any money, we can pre-collect immunizations. And so we can do a $10 payment for check, and we're going to use the IMM as the beginning for the voucher, and then we're going to put check number 12345, and we're going to save it. This can be the regional medical director if you don't necessarily know the provider. Okay. So now I'm going to check the patient in, and they're going to go back to see the clinician. I can click out of this because I've done all of the steps that I don't know what's going on. I've done all of the steps. I've done all of the steps that were needed in order to ensure that the patient was ready. So now that the patient has been seen by the clinician and it's time to check them out, we're going to post their charges. The clinicians are supposed to say their charges as the patient is leaving, and so there should always be charges for the most part, there should be charges for the patient when they leave, before they leave. So we're going to go to our patient, do not use, Haley, and we see we have charges from another visit that's on here outside of today's visit. So we're going to also take care of those. Again, we're going to select the do not use Haley as the guarantor. So we're going to do this lab. So as soon as we see the lab CPT codes start with the 8. So 8, all labs begin with the 8, and they require a referring physician. And so the referring physician will always be the provider if it's the APRN or a physician. So since this is an APRN here, we're going to go ahead and put her ailment as a quick new as the referring provider. And we're going to save it. If this would have been an RN, we would have had a supervisor here, which would have been the regional medical director. So if an RN provides the service for labs, then the supervisor will fall here, and the supervisor will then be the referring physician. So RN would need their supervisor, which is the regional medical director, to be the referring physician under the ailment section. The other thing that's needed is the financial center. And since this was reproductive health, financial centers follow the appointment type and the services that were rendered. So since this is a reproductive health visit from a previous date, we're going to go ahead and include the finance center as 2, and we're going to add that. We're going to go ahead and do the azithromycin as well. This is not a lab, so it doesn't require an ailment. Finance center is the same. We're going to add. So we're going to go through and we're going to add the immunizations as well. So this is our immunization. The finance center, since this is an immunization, should be 10 for immunization, and we're going to add. One of the things that we need to make sure is we need to make sure before we're posting these charges that our base plan is here and is accurate. And I believe that I posted 2 reproductive health charges under the SPIMM, which is not right. So we're going to have to go back and we're going to have to fix that at and I'm going to show you exactly how to do that, because that's something that happens quite frequently. And we're going to do that a little bit later. And we just need to make sure that that finance center, the insurance, is up to date. Now, we're going to add this one, and that's our last one. Here we can see that our charges have adjusted down for the immunizations down to the $10 since we have it under the correct self-pay plan code. And so now we're going to post those charges. Dorothy Crotwell is going to review that process.
Yes, good afternoon, everyone. We have a couple of questions, though, Dorothy, while you're getting ready. If
okay, I got it.
You got it. Okay, let me go ahead and get these questions out there, and then if you don't mind, and then we can keep moving. A good question was, what makes a vaccine 317 status?
317 vaccine is vaccine that was purchased by federally funded vaccines for adults. So there are some vaccines that are purchased by the state, which is the flu, and I think at one time maybe the HPV. So those are the two vaccines that purchased by the state that we can administer, but they have to be qualified for 317 vaccine, which is vaccine that was federally purchased for patients at the health unit over the age of 19.
Thank you for that, Daphne. And we have another one. What do we do if someone puts in a payment before and one in after they are seen? So they have a payment put in for the nurse and one for the medical provider.
Okay, the provider on that is not going to matter, but if it's in there twice, one of them being an error, you can go ahead and void that. If no receipt has been printed for the payment, you can actually delete it. But if it's entered in there twice, you can void one of them.
Thank you, Dorothy. All right, so we got more on what makes the 317 vaccine. So I think we answered that question, but if you guys still have a question about it, please put it in the chat. The next question is, we can post different finance centers on the same encounter.
Yes.
Awesome. The answer is yes. Okay, Dorothy. I'm sorry, go ahead.
I was going to say the finance center is posted with the particular charges. So, yeah.
Yeah, and it should coincide with the appointment type, but if the patient received immunizations on a reproductive health visit and we're billing the reproductive health visit to an insurance company, but they're saying that the vaccines are not necessarily covered under their insurance, then you can you can split it like that. You just have to make sure that your insurance here shows for the SPIMM for the immunization charges, and then for the reproductive health charges, you have the correct claim code, which we're going to go back and show you how to do that. You're going to have to void and then re-enter with the correct claim code, but we'll show you exactly how to fix that.
Okay, thanks for these great questions, guys. It really makes us slow down and think through and make sure that we're covering everything thoroughly, so keep them coming. All right, Dorothy, I think we're ready for you.
Okay, good afternoon, everyone. So before I cover the payment posting, I just wanted to let everyone know that Office of Public Health was recently audited for their cash payments. And from the results, we created a standard operating procedure that included two major issues that were noted. One of the issues was timely deposits, and the other was safe handling of cash. So the SOP is in the user guide on page 105 through 107. So please review the SOP so that we can stay in compliance. And deposits should be made daily at your health unit and no later than 2 business days. So when I reconcile the health units, their private pays, to your deposit reports, emails are going to be sent out to management if there are delays in your deposits for future training. So if a patient comes in on the 10th of the month and there's no deposits made until the 20th, your deposits are going to be considered untimely. So be sure that you keep up those deposits to stay in compliance. All right. Also, I wanted to mention that there is processing credit card sale via Converge Pay for those health units that are currently taking credit cards at their health unit. Okay, and if y'all have any questions on any of those two, please let me know. Okay, so now we're going to cover the taking the payments. So right now, what I wanted to mention about pre-collecting, sometimes when you pre-collect a payment, the journal has not been updated for the day. So when you take that $10 payment, please always be sure that your journal is for the correct day that you're collecting the money, because at the end of the day, the deposits will need to balance to your day's journal. So you want to be sure that you're posting your pre-collected payments in the correct day that you're taking the money. So here we're going to say pre-collected money is available. Do you want to allocate that payment now? So we're going to say yes. Okay, there it goes. I guess the screen's a little slow. So it's going to automatically allocate it to, we're going to select the $10 to allocate, yes. And then we're going to, it's going to automatically put it to the charge here. If it doesn't automatically put it, if there were balances through all of these charges, we would want to enter it to the charge that you want to apply it to. So this is automatically putting that in the immunization that Dana just posted. So we're going to go ahead and click post. And sometimes it'll say a cross allocation of unapplied credit. Do you want to continue? Yes. Okay, once you've posted that payment, so now there is a 0 unallocated. So then you want to print your receipt. You will click receipt here. And so the posting date, receipt options, and you'll click run. You want to click run again, and your receipt will generate. Here is that payment that you just collected. Some of the health units keep a copy of this receipt with the payment, and then once the deposit is made, that receipt can be put with the deposit slip, so that for future reference, if there's any errors that we need to correct, you have an accurate record of whose money was deposited. So we're going to get out of this. And let's see, I'm going to get out of this, and we're going to go back into her account to see if she has unallocated money to post. Every patient should leave your health unit with a statement of their account. So if you go to the patient's account, drop down to financial, you want to click statements. Oh, we need to select the correct patient. Then click statements and demand a statement of the patient's account. We're going to change this to through 10/1 because the charges that we entered was 10/1/2020. Now your statement will only show the charges that have an outstanding balance. So this patient has a balance due of $1,602, and it shows you all of the charges that have a balance. If you would like to show the patient the services that she had today that includes your paid charges, then instead of taking that EB01 statement, you can change that to, by clicking in that box, hitting the drop down, you can select the EB05 run and run, and it will include even the paid services. So
can you go back and
I didn't change the date.
Yeah.
I'm sorry, I didn't change the date. Demand a statement. Okay, we need to include the 10/1. Change that to EB05. And now you'll see the, let's see, it's It's actually 2 pages. So you'll see the 10-1 services that were actually paid for. So, and you'll also see the payments. So that includes paid services as well as adjusted services and the outstanding, and it still will show them their balance. Okay, so let's get out of here. If you are looking at the patient summary, if you look at the patient summary, you can see right here if there's any unapplied credit that needs to be allocated. So now the patient's going to check out, even though she paid that $10 at her service, as a pre-collect. If she would like to pay towards one of her charges as she checks out, you can always post a payment by clicking the little $sign. And you can click on payment. And say she wants to pay $50, or say she wants to pay $20 towards some of her outstanding charges. Then you can enter $20 into your check or cash. Or let's say she's going to pay with credit card today. We'll take a charge card. And of course, you're going to run the charge card through Elevon's Converge Pay. Your voucher should always be the program that she's paying for. So the services that she's going to be paying for with this payment is going to be reproductive health. So we're going to put the program first and then CC for credit card. This verification here does not need to be completed. This is only if we run credit cards through Entergy, which we do not. So the date that she's paying is on 10/1. The reference date should always be the date that they're making the payment. And then you would click Save. And if it says it's not been authorized, continue, because we don't authorize through Entergy. So now we want to I'm trying to see where a balance is. This is only showing. This is showing unallocated. Okay, I'm just going to post that payment, and then we'll go allocate it to the previous charges. Not letting me post it. Okay, well, let's post that and close. Payment is not. Okay, so I'm going to send this to unapplied credit. We're going to post this money to the regional medical director. Department is one to be
No department.
no department. Okay. So now we want to allocate that money. We're going to go to financial. We go to payments, go to account, choose our patient, Haley. And we have, if you notice here, we have $20 of unapplied credit. So what we want to do is allocate that unapplied credit. So you would select unapplied credit. We want to click unapplied. Now we want to allocate all of that $20, so we're going to put the $20 in this box here, say OK, and then it's going to bring us back to the account payment posting screen. So we want to allocate that $20 to, well, should have put it as 10, but we'll put, we're going to allocate it to this charge here. Apply it to the charge that you want to allocate it to. And it's going to say the provider does not match, and that is okay. And once you allocate it to the charge you want it to be applied to, you would click Post. And now that payment is applied to this charge. And you can close this, and you can look back on the account under Personal and Summary, and you'll note, well, we'll need to refresh that screen. And now you'll notice that the total of unapplied is now 0. So if anyone has any questions on that, go ahead and.
Yeah, so we do have, we have a couple of questions, but I don't see any. Let's just go through them real quick and give folks time to use the chat for questions regarding what you just went over. So there was a question about what about when it's an exception to give the vaccine due to an outbreak? An example would be Hep A. And so I got a little more clarity on that. The question is regarding the 317 status and how payments are applied for those exceptions.
I think the most recent direction when it's an outbreak is that in some instances you create a no bill. We would have to adjust those funds off if you create a bill for it and the patient's not responsible for it. Just like the immunizations, I think we're going to do this time. It may leave a balance, but we may have to go back and write a report just to adjust those off. We just have to indicate that it's for that reason.
And if you guys don't mind going through the 317 status one more time, what does it make it as a 317 status eligibility?
So what makes it 317 eligible status is if the patient is over 18, so 19 and over, and they don't have insurance, they qualify for any vaccines that we have for adults, basically. For state purchase vaccines, they're responsible for, all of them are responsible for the $10 copay regardless. So if they're 317, they just owe the $10 vaccine and they do qualify if they don't have any insurance or if they say their insurance doesn't cover it. So any vaccine that we offer for adults, they can receive. Does that make sense? That's the easiest way I know how to explain it.
Yeah, and it would probably, I mean, if we're still questioning it, let's unmute and let's chat it out, because I'm sure not one it's going to be a question that more than one person has, so please feel free to unmute yourself. And then I'll go to the next question just to give time in case somebody does want to jump in. So somebody asked, can someone come out and check their credit card devices? So I think it's, if we want to announce what that process looks like, how can someone get service for their credit card machines?
Yes, this is Dorothy. So are you at Metairie or Marrero? Is that Janine?
So in short, since we're running on time, I will reach out to Dorothy Crotwell. Dorothy is our administrator for credit card machines and implementing those across the state. And if you for users, new users who need to be added to the system, as well as if there are any issues, she can help get you in contact with the right people in order to help resolve it. So please send an email to Dorothy.
Awesome. Thank you, Dana, for that. All right, that looks like that's all.
I think there's still maybe some confusion on confidential billing as well. I received a question again as to why we would have to remove the insurance if the patient selected confidential billing. So if the patient has insurance and they're sharing their insurance with their spouse or with their parent, and there is a very good chance that the insurance will send an EOB, explanation of benefits, to that patient's home to say that they received service and how much the insurance company paid for that day. And if that patient says, well, I don't want an EOB sent to my house because I don't want that information getting back to someone who I live with, then they have the option to say, yes, I want confidential billing. But if they select that they want confidential billing, then somebody's still responsible for those charges. And so then that patient would then be responsible for the charges instead of billing the insurance. And so that's why we would unselect the insurance information if they select that they wanted confidential billing, so that, you know, their household assessment, based on their household assessment, they will be responsible for those charges based on that. We can't tell an insurance company, hey, this patient don't want an EOB to send it, so if we send you these charges, don't send it to them. So the only way we can stop that and prevent that from happening is not billing the insurance at all. And the point of adding it to the confidential status piece is just saying, you know, this patient did select confidential status for this particular date, and so we'll know and we'll have a record. That's why we did not bill their insurance for that particular date and those charges. If that's not clear, please let me know so I can try to explain it a little bit further, or get Tammy or Tish to explain it a little bit better if that didn't get it done. Okay.
Thanks. Yeah, I think that got it done, Dana. Thanks.
Okay, so now that the patient has received their receipts, received their statements, now we're going to go back to the patient tracker, and we're going to just record the event as the patient is OUT out. Okay, and so now at the end of the day, what we want to do and ensure is that we are looking at certain information or certain fields. And one of the first thing we want to do is we want to go to pending charges before we end that day. And this is being recorded, so this is going to have to be grayed out, y'all, because I don't have a way of selecting it. So I'm going to go to my location, and I'm just going to pick a number at random. These are the people that I still have charges out here for. And so you want to make sure that you make a process daily to go out and check the charges. What will happen, the process for labs, not all of the charges will drop at one time on the date of service. Labs will come back as they're resulted, and they will drop a charge once they're resulted. So you could have a patient who received lab services 2 weeks ago and was resulted today, and so you have those charges there that need to be posted. So I will go here every day before you leave and ensure that you look at your pending charges and post those pending charges that are still there. The next thing we want to do is we want to go to journal management, and we want to pull up our journal for that day, and we want to look for any unallocated payments. This is the next thing, you know, this will help us to make sure that we've allocated every payment, every receipt that we received for today, and that we have nothing that's outstanding. The revenue team is sending those emails to those persons who have unallocated money, but this is one way that you can ensure that you're never sent an email about unallocated money. Okay, so this says that all my money was allocated. The other thing we need to do is look at the unresolved encounter report. This one right here says all of the encounters that I have are resolved, so I don't have any unresolved. You could potentially have an unresolved encounter because there are no charges on a patient's encounter. And so if that happens, if you see that a patient falls on that report, you want to make sure, first of all, that they really actually were seen in the clinic that day. And if they were not seen, you want to mark them as a no-show. If they were seen, then you just want to get with the clinician to say, hey, this is falling on the unresolved charges. Do you know when we will receive those charges? Once the charges are posted, it's going to fall off of your off of the unresolved encounter report. The third thing you want to do at the end of the day is look at your journal report. You want to make sure it says all provider, all users. So if you're working with other people in your clinic, they could be using and accessing the same journal. So you just don't want to select your own individual user. You don't actually want to exclude any providers either, because you want to post everything and see everything on that particular journal. And then once you run it, it'll pull up. So these are basically the charges that we have today that we posted. These are the adjustments that were made and the payments that were allocated. If you go to the end, that is your journal cash analysis report. And what you want to do is ensure that any checks and cash that was received today, that you are look at your deposit slip, your bank deposit slip, and make sure that they match and they mirror. For any charge, any credit card transactions you completed, that's going to be right here. And so you want to make sure you have that and compare that to your Converge report for the day. And you want to collect all of those reports along with the journal cash analysis report, print that and keep that. So at the end of the month, when you're sending your deposit report to fiscal, you'll have something. If there are any questions, you'll have something to come back to. So always remember, checks and cash need to coincide with your deposit report, and then the credit card charges need to coincide with your Converge report. And those are all of the reports and activities that you need to do at the end of the day. And then once you've done that, you can go and you can close your journal out. This is saying that somebody's still in it. So if somebody's in your journal, you're gonna have to go and say, hey, I really wanna close my journal for today. I've checked everything. And then if somebody's in it, they might be doing something too that could impact the report that you just ran. So you just wanna make sure, that if that is the case, you go back and you rerun the journal management report to make sure that everything's okay, that they were not posting payments or anything. And once everyone's out, then you can go in and close the journal. And it's going to just verify if you want to close the journal, and you're going to say, yes, you accept the journal close date. And you can say, no, I don't want to open a journal for tomorrow's date, because the next person who comes in the morning is going to ensure that that journal is open. So we did have, and we're running short on time, so we're not going to necessarily go over like the troubleshooting piece. I think that that's going to be important for us to do. So we'll save that piece for the next training, making corrections to the system and troubleshooting. If we're sending you out information because there was no troubleshooting, we're going to give you the directions and the instructions on how to correct those things. If you have a problem and you need help, make sure you go and use your front office guide. Everything is in there. All of the, it's multiple instructions. Like if you didn't, like in the beginning when I didn't include that name, so that, the insurance information for my reproductive health service, I'm going to go back in, I'm going to void. There are directions on how to void the charge. Then there's instructions on how to add. And so you're going to follow those instructions. Even though they're not together, you're going to have to know what steps you need to do in order to fix it. But if we've sent you that, we're sending instructions. So, and if you need help, just reach out to your super user as well, or your supervisor. Are there any other questions?
Yeah, Dana, I don't see any. Great information, though.
Thank you guys so much.
Yeah, and if you guys want to, if you think it's something, star on 6 to unmute yourself. We'd love to hear them. All right, we'll keep going.
Hey, Daniela, this is Tammy. Can I just ask one quick question? If everybody could please go into their pending charges and ensure that all of them are put over into the journal like Dana just demonstrated, because we do have some charges that have been there for 6 to 9 months that are just hanging out, not getting billed to the insurance, just sitting there. So we need to go ahead and get those done before it's too late to bill the insurance.
Yeah, that's a great point, Tammy. Thank you for that. Okay, next slide. No questions? Going once. Next slide. Laura. Hey, Laura, if you're talking, you may be double muted.
Can you hear me now?
We can.
Sorry, I was waiting for the lady to tell me I was unmuted. All right. I'll talk to you about the receiving a parameter not valid error. They're seeing this on the EHR side. They will receive an application error that says parameter not valid. When they select OK for that error screen, the EHR side crashes and they cannot access that patient record. This is a known issue in Entergy. Next slide. And it's caused by scanning in a photo ID card that is not in JPEG format. If you receive a scan for an ID card that's in a PDF and you try to upload it here to the photo ID section of patient administration, it will think it has accepted the scan. It'll show that it's scanned by someone, like you see on this slide here where it shows that I scanned it. I actually scanned in a PDF. That PDF exists as far as the system is concerned. It won't display it, and it doesn't know how to resolve it. So when they try to access the chart on the EHR side, it crashes. The only way to fix this is to go into patient administration, pull up your photo ID screen. When you open it, you'll notice that your radio button is on the front. You're going to have to click to the back and then go back to your front screen in order to highlight the delete button. Once that delete button is active, you will need to delete what the system considers a blank scan. That's the only way to fix that parameter invalid issue. If you are not able to delete the scan, please send in a help desk ticket and we will try to resolve that for you. But this is caused because the photo ID scans are not in a JPEG format.
All right. Any questions about that, please put them in chat. We do have a question about a journal. How long are we supposed to keep the journal open, Dana?
So we're asking no longer than 48 hours, but clerical needs to ensure that they're working with clinical to make sure all of the charges that are needed to be posted are posted within that time frame and that they're not missing or waiting on anything. So 2 days.
2 days. All right. I'm super proud of you guys for the engagement and the questions, man. It makes it so much easier. All right, let's keep rolling. Next slide.
Hey everybody, this is Deborah Even, and we reviewed this in July, and it was kind of new because we had just updated it. I wanted to bring it back up and bring it to today's training just as a reminder. So you all are in this top box where it says all clinical and clerical staff. If you have any technical issues, hopefully the scanning issue will be resolved, but other issues, you're going to go to the help desk for those things. For anything else, ideally, you would look in your user guide, and we do recognize that, especially on the clerical side, that a troubleshooting section would be ideal. And that is something we're hoping to engage your super users to assist with. First, look in the clinical guide. If not, ask your super user. If the question is still not able to be answered using either one of those, then the super user will take this to your RAM. If your RAM is still having issues and it's just something that, you know, has to do with the system or part of the workflow, then that will come to me and to Precious, who introduced this training today. And then we'll get with the programs and try and figure out what the workaround could be. And of course, that needs to go up to the steering committee. So patience on that end, if that's the route it goes. But we're hoping that somewhere along this line, you know, your question gets answered so that we can all make sure that we're doing things the right way in the system, so that what we put in when we try and pull it out, it's accurate. Next slide.
Okay, and to drill down on that just a little bit, I wanted to talk briefly about how to get some help for some of these common issues. Excuse me. For anything that is a basic computer function, your computer won't start, you know, you've got a slow internet connection, or your internet is down, you are locked out, or you need a password reset. Basically, any sort of function that exists without workflow involved. Just go ahead and create a help desk ticket right off the bat. And you can create a help desk ticket by either utilizing the online portal at ots.la.gov. I'm sorry, otsupport.la.gov. You can call 219-6900. There is both a Baton Rouge local and an 800 number. Or you can email otsupport@la.gov. And all three of those will be able to get a ticket created for you, and then we'll be able to respond accordingly. If you have a patient merge, we've already covered this, that you have to proceed carefully, and that's where your user guide comes in. Consult your user guide, because there are going to be all of the required steps that have to be completed before you submit that help desk ticket. If you submit a help desk ticket and you have not completed those required steps, we're going to kick it right back to you and say, please complete these required steps before submitting your ticket. For the scanner issues that y'all are all having, consult the workaround. It now exists in Moodle within the appendix of the user guide, and it's also in this video. So create or use the workaround before you create a help desk ticket. If for some reason you try to do that and it's still not working, go ahead and create a help desk ticket. We'll be more than happy to help you out and figure out what exactly is going on. Registering a new user. Complete the new user request forms that are found on Moodle. If you just send me an email saying, hey, I need a new user, I'm going to email you right back and say, please complete the new user request form. Voiding encounters. So we've seen this a couple of times, but once again, consult your user guide, then consult your super user. If those two things don't work for you for some reason, then go ahead and create a help desk ticket. And then lastly, this one is sort of the general catch-all. Anything that we haven't covered, you know, oftentimes users find better ways to do things, or they discover a bug that, you know, we just haven't seen before, or haven't, you know, really noticed. Consult your user guide first to ensure that we haven't already covered this. Then go to your super user. Then go to your RAM. Basically follow the communications flow, because chances are good that if you go through all of those steps, it will wind up at the steering committee and we will make the appropriate adjustments as needed to correct that. Once again, help desk tickets, online, email, or phone. You've got 3 different ways to get to them.
All right, we're going to talk about a few additional training resources. Of course, there's your EHR clerical module on Moodle, in case we haven't said that before. Under the resources section for the clerical module, there is a document for accessing the VIA classes. There will also be a clerical additional training document for today's date uploaded tomorrow, and that will have a listing of some of the VIA training videos that you can watch that will help you with some of these processes we covered today. Next slide. In addition, if you still have questions, you can of course review the video of this training that will be updated tomorrow. You can review your front office clerical user guide. Be sure you're looking at the revision date of July 1st, 2020. And some of the related page numbers for each topic will be listed below. This slide is actually from the additional training document you will find on Moodle, so we'll add in those missing page numbers. But this gives you an outline of some of the topics we covered and guides you to where you can find additional information for each of those items. And next slide. So last chance Q&A, folks.
Yeah. Thanks, guys. So we did have one more question in the chat, and that is journal closure, 2 working days or 2 calendar days? We just want a little clarification, Dana.
Two working days.
All right, business days, working days. I thought so. All right, we'll pause for a minute. Man, we timed this just right at 3:59, but we absolutely want to get all your questions in. So please feel free to use the chat. And that last question was specific to Friday journals. So those won't really be expected to be closed until Tuesday, correct?
Yes.
That's right. Hey guys, this was a lot of information. We're hoping this was just a refresher and you're some sort of superhero and you somehow remembered all this. I know I've learned something. So I'm hoping you guys took something away from this. We are so thankful that you spent this time with us. I did get quite a few private messages and private messages about patient portal. And so I wanted to point you guys to Moodle again. There was a training on August the 10th. And so there's a training video out there, and also there's the consent for portal in the resources for clerical module. And yes, we're absolutely live with portal. We've noticed that the participation in it is really low. So we encourage you guys to start inviting. As soon as you get those consents signed, go ahead and push it out. If you guys have any questions, anybody on in clinical operations, which is Precious and Deborah, any of your statewide consultants, or anybody on the BHI team are so happy to help you guys. We don't want to hold you guys much longer, but we will hang around for a few minutes for any last minute questions. We do have one.
There was additional questions.
Yeah, I just seen it. Thank you, Dan. What if it falls on a holiday such as Wednesday before Thanksgiving? Is it okay to post that on Monday?
So it's 2 working days, right? So if we're off on Thanksgiving, then we're off on the Friday after Thanksgiving, then by Tuesday, it should be, Tuesday of the next week, it should be posted.
Yeah, thank you. Those are great questions.
Yes, absolutely.
Yeah. So again, guys, Moodle is the source of truth for all of us. If you notice something that's not on there in the resources and you think it would be helpful for yourself or for anyone in the state, really, please reach out to us and let us know. We'll be happy to post it there. We appreciate you guys. So have a great evening, and we'll hang around for a few minutes just in case there's any more questions. Thanks so much.